There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
Sometimes the Dash diet can get confused with Mrs. Dash spices. They are not the same. Focusing on nutrition high in real foods, predominantly veggies, high in potassium and without processed foods and added sugar can be beneficial for high blood pressure, as was shown in the Dash diet trials. But for someone who is sensitive to sodium, it is a good idea to find non-sodium-based spices to use. I agree, however, with the prior answer that it BP that high. The general recommendation is to start medication. The hope would be that the med could be stopped in the future with improved lifestyle interventions, but bringing down the BP should be a more urgent priority at that level. Yes. That's because for many people this can be a great way to reduce sodium intake, which in turn can help reduce blood pressure. There's also another secondary reason. The combination of ingredients in the mix may also have health benefits. Take Mrs. Dash Original Blend 2. For example, it contains garlic, which multiple studies suggest can cause a notable decrease in blood pressure. These benefits are secondary because the claims about garlic benefits are for a 10% reduction in blood pressure. To get a 200/130 reading down to 120/80, a 40% reduction would be reduction with footnotes. 1. Effects on blood pressure of reduced dietary sodium and the dietary approaches to stop hypertension, DASH, diet. Rehn 2. Mrs. Dash Original Blend 3, Garlic, Scientific Review on Usage, Dosage, Side Effects. At those levels, your father needs medication. In the best case, cutting salt drastically will only lower his blood pressure by around 10 mm Hg. There's no way around it. You have to start with medication. Once you have things under control, there are dietary and lifestyle changes you can make. Optimize circadian rhythms. Get lots of sunlight in the morning and avoid artificial light at night. Eat breakfast in the morning and don't eat after dark. Get plenty of sleep. Experiment with a low-carbohydrate diet or a fasting protocol. All of these options have at least some experimental evidence to show that they might be helpful. Mrs. Dash seasonings are sodium-free, but so are most house masala in India. Use tasty fresh spices in your food. Simply leave out the salt. Get the freshest herbs and spices you can and use herbs, spice, garlic and ginger generously in your food. I just reread the question. Is 200/130 your father's blood pressure? If so, he needs more than to cut back on salt. He could have a stroke and die or be permanently disabled. If his doctor is only suggesting he cut back on salt, he needs to find another doctor.